Hello, welcome to our Friday webinar with Dr. Tom Tully. Hey, Dr. Tully, welcome.
Well, how you doing, Laura? Good to
I
see
am
you.
doing good. Yeah. It's been I feel like we haven't had any ask the vet questions for a little pot. When was the last time we had you on? Was it last year? Was this no, we had you last
Yeah, it
month.
was last year. We didn't have one last month.
Oh,
Right?
that is right. Okay. Can you just
This is
imagine?
the first one of the year, which is good because although the groundhog did say 6 more weeks of winter, according to
Oh, okay.
Oxitani Phil,
Yeah.
um, we're kind of on the down slope toward March 20th, 21st, something like that. So
Wow. So
there
an
you go.
extended winter. Okay. All right.
Yeah, yeah.
Plenty where I am. So but I'm sure, well, let's see where everyone's logging in from today. We got New York City. Just love to see where everyone joins us because we've got just different, I mean, just different environments that could be people,
Yeah. Well,
right?
I
We've got,
mean, we had like 7, 8 inches of snow here in Baton Rouge this year, and then it
wow.
snowed, it got down to 4 degrees and all of that good stuff. And it was like, oh, that's cold. But
Oh,
the, then the next thing you know, it's 80 degrees the next week. So,
yeah.
so it's been a little chilly, as you can see. I have my vest on now.
So
But
what do the birds think when it's like, oh my gosh, it's snow. Oh wow, it's like they're just all
oh
out.
well, the chickens. It's really, if you have backyard chickens, that's really a problem because if it gets too cold and it's not warm, then they don't drink. Then you have issues with them eating and not being able to digest. So you have
Wow.
problems, with chickens in particular, with anybody with backyard chickens. And I guess if you're getting eggs that way, it's cheaper than if you're buying them, from what I'm to understand, the egg
That's
price.
true.
Yeah.
Yeah, yeah, that's true. Unless you have like a cocktail, it's your little tiny eggs just
Yeah, little eggs or ostriches with
big
big
eggs.
eggs, right?
Yeah, yeah. Oh, that's fat. We got people from Denmark, Canada, Mexico. We got people from everywhere. Like
Very,
this is
very
awesome.
good. Welcome.
Illinois.
We're anxious to get some good questions as we normally do, um,
Okay.
and it's going to be a great hour, and always learn. We all learn together.
Yes, yes. And so that reminds us that that if you do have a question, to use the Q&A feature and not the chat feature so that we can see it quickly and get it over to Dr. Tully. So yeah. Um, this is I can't wait to see what question. So wait, so it just says wait for the first question. What would be like let's say you need to pay attention to the weather, like if you have backyard chickens and you could have snow one day and sun the next day. You kind of have to follow the weather reports, right? Like if you have an outside
Oh yeah,
aviary of birds to
yeah, definitely, and also you need to plan accordingly. You need to make sure that the facility, the coop, if you will, is environmentally uh, protective of the birds, both if it's cold outside or if it's extremely hot. Because as we've mentioned before a number of times on the webinar, that birds are more sensitive to heat because they can't dissipate
Mm.
heat, uh, as well as being and also accommodating to the cooler weather. They can withstand cooler, colder weather than much better than they can heat.
Okay. It's good
Hmm.
to know. All right. So we have a question from Liz about a female red-rumped parakeet um, that has had uh, rhinolith in the past, which has been removed, but her nostril slash nair is still larger than usual. So what can they do to prevent another rhinolith from happening? I hope I said that right. Did I
You
say that
did.
right?
You
Okay,
did.
good. I'm
Very
on the right
good.
track. Yes.
And once it's a rhinolith, it's not similar
Yes.
to a rhinoceros, but a rhino is kind of in the nasal area, and so a rhinolith. A lith is a stone or a growth within the nasal cavity, and so what can occur is that when say these rhinoliths are removed, uh, it usually in birds it's not like a stone develops like you have a urolith. A urolith is a stone in the urinary tract. Okay, so you can have a bladder stone, urethral stone, kidney stone, and so those are liths also, but those are more of a kind of a circumscribed. The stones are like if you see a pebble, okay, but the body actually forms those of different composition of minerals, because you can have some different stones develop. Now, what this is kind of, you say a rhinolith, and you say, well, a stone, kind of a stone of different mineral composition develops in the nose. That is usually not, that usually does not occur in birds. What happens is that birds get usually infections that affect the lining of the nose, the nasal opening. And then what happens is we have what are called granulomas, or the tissue responds. It's inflamed, it's irritated, and you have the the growth of that tissue through that inflammation and irritation. It gets bigger, and it forms thickened areas of cellular debris within that nasal opening, and it just keeps growing, and it expands that nostril on the or nares on a bird, and so you can get malformation of that, because you have this growth that keeps growing within that nostril, and it's expanding that nostril, stretching all of that tissue, and it gets bigger. And so when you remove that granuloma from the nostril, because you can, I've done this on many birds, but it affects African grays, not necessarily red rump parakeets, but it can affect any bird. But African grays, this is a problem. And when you remove that granuloma, that distension and that malformation of that nares is still there. It's larger, it's bigger, and unfortunately, that tissue has been distorted enough that it's not going to go back into place. Now, you may get some reduction in size, but for the most part, that nares, that nasal opening, will stay kind of deformed. Okay, and they have nasal distortion in other animals, and it's called atrophic rhinitis, and it can happen in pigs, and it's kind of been utilized, that term, in birds, kind of as a way to describe it, but it's just a really a distortion of the nasal opening, and really it's not going to go back to normal. It'll always be enlarged. Now, what causes it is usually either a bacterial or a fungal infection, and you can identify that through where you can identify it through culture and sensitivity. And so that's how you would identify it and treat it accordingly. That can again, that can kind of resolve the issue, But in my experience, that once this kind of the birds are susceptible, have had this, and then there's a breakdown in the normal kind of tissue structure within the nares, that they can get these to recurrences are not uncommon. And I think that's what the questioners, how can we prevent this from happening in the future? And the one thing that, like I said, is to try to identify specifically what bacteria, what if it's a fungal infection, because antibiotics, you need antifungal medications. If it's a fungal infection, you can have both a bacterial and a fungal infection. But to identify that and treat it appropriately, treat it topically with kind of nose drops, because that could be more effective than treating it when we call systemically or throughout the body if you give it orally. So you kind of have to go in kind of a dual kind of treatment protocol to try to to reduce the chance of this reoccurring. And for the most part, on some of the more difficult cases that we've had that I've treated with African grays, I usually tell the owners that this isn't something that we treat today and it goes away. This is something that is it kind of can reoccur. Even the initial treatment may take 3 or 4 treatments, and what we're trying to do is to reduce the time or increase the time between each visit. So it's kind of you have to do it in steps with this type of presentation. It can be it's a difficult disease condition, but it is something that this is a red rump parakeet, but it occurs in a number of different species. But we check for that when they come in for physical exam. But sometimes I've had where I could it has distorted and has been so severe that I could put a really a probe in one nares and come out the other. It has eroded the wall between the nares, and so that's how severe it can get and really distort the nares very much. So it's not necessarily a stone, but more of a granuloma formation that gets bigger and bigger and bigger and bigger, and you just have to remove those. It's pretty rewarding to remove some of those big ones, but it is something that you have to look at as you have to be somewhat aggressive on these, and that it's a process, it's a step process. But it's a great question because I don't think we've had that before. No. And this is something that is not unusual. Yeah.
So you see these fairly often or kind of often, or?
I've seen them, I haven't seen any recently. But it's one of those things where we're talking about it, and next week I see 3. But it is something that I would say is it's not uncommon. Yeah.
Okay. So we have a question about a red diamond dove. So red diamond dove parent here, Diane asked a question about their diamond dove just laid their first egg yesterday. So any special care that they need to provide? It's a great question. First time egg layer.
No. I mean, there's other than you want to make sure that the environment around that bird is as stress-free as possible. That's the main thing, and not to bother it very much. And then also, as the bird is laying, to make sure that the birds have calcium supplementation and the proper diet um, to maintain their general overall health. But the calcium supplementation for doves would be the only thing in the stress-free environment to give it the best chance of setting the eggs, and because another egg may be on its way if the egg was the first one yesterday. And so you want to make sure those calcium stores are good. Yeah.
So do you take the egg away? Do you leave the egg if, I mean, assuming it's not a fertile egg, do you?
Well, I didn't know if it was I was assuming that there was the bird laid an egg and that there was another bird in there, but maybe
Yeah, I'm not
not.
sure. That's
And
maybe more details.
that's a very good point because that what I had stated was for if we feel it's fertile and you want to have little baby doves. And the other kind of question is that if it's a female by itself in the cage, what do you do with the egg? And and may have touched on this in one of the webinars in the past, but because you do have like I had a female cockatiel laid eggs. Okay. Now you can put an implant in there, and there's been some studies on the desmorilin implant to reduce that bird from laying eggs. So that's good if you want to do that. The one thing about the first is that I've had questions to see if the egg, is the egg fertile if there's no other bird, no male in there, and I would say that that no, it's not fertile. Okay, it's like the chickens that lay eggs and that you buy at the store. Those are not fertile eggs unless they're a backyard. You get them at a farmer's market or something like that. And there's a rooster running around the hen house. Those could be fertile, but the commercial eggs are not fertile. And so that's the first thing. The second thing, so whatever you do, you're not, killing a little bird.
Oh, no.
And so the one thing
Sorry.
that you have is with the eggs, do you remove it or do you leave it in there? I think it doesn't matter what you do one way or the other. Now, some people may have more of an opinion. Well, you definitely have to leave it in there because if you take it out, they're going to lay more eggs. Well, I've seen where there's 50 eggs in the bottom of the cage. So leaving them in there just kind of begats more eggs. And so I'm also concerned about the eggs being a source of kind of a bacterial culture media. So I'm one to say remove the eggs, and so I don't want to give the bird any, and that's what I did with my cockatiel, and I don't want to give them any thoughts of nesting or what have you. And so you can leave them in, you can take them out, but I just don't like those eggs just kind of laying around or even in the nest box that the birds keeps going in. And how long have they been there? How old are the eggs? Are they rotting or what have you, or drying out, or and it's just kind of a bacterial culture media. And so I say, I just say I would recommend taking them out.
Okay. And I don't know if we've ever had this question before, but Eileen wants to know, is it safe to feed parrots shellfish?
Is it safe to feed parrots shellfish?
Yes. And you're from Louisiana, so that's kind of
In
like
Louisiana, and I'm sure that there's been some parrots that have had some type of shellfish or what have you. And and I haven't heard anything to um, uh, say that it isn't. So therefore, I would say that that's I wouldn't think that it would be harmful, but again, unless that would be I mean, that's a great question. So I don't think it would be harmful, but I don't, unless that bird has a natural diet that includes shellfish. Again, I think that it wouldn't be something that I would want to feed um, on a regular basis or often or what have you. If you wanted to, oh, well, you want a little piece of shrimp, it's good. I like it,
Yeah.
and see what the bird does. Well, then, I don't think there's anything wrong with that.
Yeah.
But, you want to try to stick to a good nutritional diet, on that.
Okay. Okay. And then we have a question. Do parents have to worry about bird flu? Parents, sorry, parrot parents worry about the bird flu H1N1. Anything that we should do differently since, I got the bird flu going around?
The highly pathogenic avian influenza, and I would say, yes, I think that you should be concerned. We have not had any birds. I haven't um, really seen where I'm sure that there may have had parrots infected with it, but and I guess the reason I haven't really been said, oh, well, I know like there's been reports of 3 parrots infected with it, or these parrots or macaws. I'm just going the conservative route, and I'm saying that, and we're protecting our patients. If we have any suspect patients or patients that have been outside, we quarantine them before and get negative tests before we bring them into the hospital proper. So we're doing everything possible to protect both our patients and also identify the virus. We haven't, had any of our patients, parrot patients that have had it, and I'd be the first to tell you if we did.
Mm.
But I think that everybody should be vigilant in this situation and consider it as a potential threat to a bird, especially if it's outside. If it's not outside, then it's going to be highly unlikely that the birds would be even exposed to it. So that's the one thing to keep in mind. Where you have the biggest problems, if you have a pond outside and you have multiple waterfowl and things in the pond, because that pond could be a site for migratory birds. You can have Canada geese that fly from one pond to the next pond, and so there's a lot of exposure to new birds that can fly in, and so that would be where you most likely would have the highest possibility of exposure to uh, avian influenza in those waterfowl or the birds
Okay.
that would be surrounding that pond or
So
lake.
if your daily walk includes a walk around a pond, would you want to like make sure you leave your shoes outside? Would that
Yeah,
be?
I mean, yeah, I mean, that would be something that would be a good practice. Yeah, thank you. Yeah.
All right, we got a question from Frank. Oh, they have a 22-month-old double yellow-headed Amazon with inflamed cere and slight swelling. So the vet prescribed silver sulfadiazine. Uh,
Mhm.
is this a viable treatment? Second question. So that he weighs 600 grams, and is that a healthy weight range for the for an Amazon?
Well, I mean, let's see. It's a 22-month-old double yellowhead Amazon. Congratulations, a young doublehead Amazon. Just don't see many 22-month-old. See usually 45-year-old double yellowhead Amazons. But nonetheless, congratulations on that. 600 grams. Yes, I'd have to see the bird because just like any, I know there's attendees today that have seen, 800-gram blue and gold macaws that are small, and then you've seen almost 1,000-gram blue and gold macaws, almost a kilo, maybe even a little more, really big blue and gold macaws. So you can get a variation in size of different species of birds. And so the same goes for a double yellowhead Amazon. What you're really looking at is the body condition of the bird. That's what you're really looking for, and how that body condition is on that bird. It's just like a human. If you're 5'4" versus 6'5", you know, you know, is 200 and 40 pounds good for my human friend? Well, that wouldn't be necessarily a healthy weight for somebody that's 5'4", but for if you're 6'5", it would be. So you're looking for body condition on the birds, and that's what we're doing. You measure it by pectoral muscle. Okay, so it's the chest muscles on the bird, and so you think of a Thanksgiving turkey. Okay, and that would be high body condition. Okay, that would be a highly conditioned bird. All right, and then you have a bird that is very thin. Okay, very thin, and all you feel is the keel bone. That would be poor body condition. And so what you want is something right in between that, the Thanksgiving turkey and the one that is, there's no muscle really on the keel. So you want something right in the middle. So you just kind of that keel should be kind of, kind of rounded on that, not bulging out and not like a razor. Okay, so you want it kind of just just rounded, and so that's what you feel for, and that kind of can give you an idea on if that 600 grams is appropriate for that size of a double yellowhead. And so that's what we try to assess when the birds come in. So it may be 600 grams may be. Now you get down to the kind of, you had the sear, you said there was some inflammation. Well, it was inflamed, and put in silver-sulfadiazine is a antimicrobial cream. It's white, and it's antimicrobial cream with silver in there. Silver is a very efficient and very good antimicrobial, I guess, additive to topical wound treatment. And so yes, it's good. The issue is why is the what's causing the inflammation, and so because it's somewhat unusual, and I'm sure your veterinarian's doing a great job on assessing it and seeing it. You can have topical. Now, what the silver-sulfadiazine is going to be effective in is if it's some kind of a topical infectious process that's causing it. Topical meaning on the skin surface. Okay, And so it's on the skin surface over the nose area, that fleshy part between the nostrils. And that would be helpful in treating an infection that would be causing it. Is it trauma? Is it if it's keeps hitting its rubbing that area against something, then the medication isn't going to be effective. It's going to still do that. And then also, if that swelling of the cere is being caused by, say, an internal in the nostril, in kind of the upper respiratory area, by an infectious process, then the topical treatment isn't going to be effective. So there's, it's finding the underlying cause of it will determine what if you have an enlarged cere. So at this point, like I said, the veterinarian seen your bird, has assessed that, and has determined that it is a possibly associated with an infectious process. And if so, and it could have been initially caused by some type of trauma, but the silver-sulfadiazine is effective in many cases in treating that. But I just also wanted to give some other, underlying reasons that could cause that swelling on the cere, and that it has to be treated appropriately to get it to resolve. Yeah, very good.
Okay. Got a lot of kind of like the nose area today. It's questions.
Exactly. Yeah, this is nasal day.
It's nasal day. I love it. All right.
I like it.
So we have a
I
question.
like it.
We have a question from Dawn about a 5-year-old budgie that has been battling a crop infection since November. So he's gagging, like something is stuck at times, but he only spits up saliva to the point it's on his head a handful of times. So he was on doxycycline,
Yeah.
and now he's on ataconazole fungal meds currently. And he was on another antifungal last month that they no longer know the name of. So he seems to be on the road to recovery, but then he relapses, and he is intermittently energetic, seems to come back after his course of meds is done. So what do you recommend? Is he on the right course? Do you want to, yeah, what insight do you have? Is he on the road to recovery? Is this something that he's going to have to worry about reoccurring?
It's yeah, and thank you so much for the question, because it's anybody that has budgies, and I know a lot of our attendees have budgies. I have budgies. They're wonderful. This is not an uncommon issue with budgies, and so when you're looking at this and you say, well, it's a crop infection with a budgie, that it appears that your veterinarian is trying to get down to the bottom of it. But what could cause this type of condition? And we see this in many different birds, but budgies can have a tendency to have some of the signs, this regurgitation, and it may be associated with losing weight. Also can be associated with diarrhea. Kind of one of the things that is avian gastric yeast, or Macrorhabdis ornithogaster. I know we've talked about it a little bit on the webinars, but this is one of the things that you say, well, why are you treating with an antifungal on a crop infection, right? Because usually if you have a GI problem, most people think of fungal infections as associated with respiratory, African grays, aspergillosis, and any number of situations when you can have fungal infections. I've had this in ducks too, and a number of other species. Penicillium had a Pyonis one time, and it was respiratory infection. So you say, well, why antifungal? Because I think it may have been itraconazole was the drug, that was one of the antifungals. The other antifungal medication that may have forgotten about was amphotericin B, which is a medication that is often used and has been as thought to be the best treatment for Macrorhabdis ornithogaster to try to resolve, not necessarily, I didn't say cure, but resolve some of those clinical signs. The issue is, how are you given this medication? If you give it in the water, unless you're giving it orally, and most in amphotericin B, the first antifungal may have been given in the water. The itraconazole could be given orally, like a drop, but nonetheless, it may explain why you are getting some treatment response, but then you stop the medication and the bird gets, has the problems reoccur. The problem is that you can treat for a long period of time, and antifungal medication, and all medications have side effects. And so these side effects may be, and they increase the chances of the side effects the longer that you treat. That's why we don't say, well, I'm going to take my antibiotic and antifungal medication so I don't get any fungal infections every day. Okay. Because you only want to treat when you have it, and when the good outweighs the bad with the medication, and treat for the appropriate length of time. With Macrorhabdis ornithogaster or avian gastric yeast, there's no treatment that has been shown to be effective. This is very problematic when you have large budgie facilities and aviaries where this is involved. It's like they've done a lot of studies and treatment studies and different medications, and that's where amphotericin B has been found to be the most effective. But at the same time, it's never have been where it has totally cleared the birds of the organism. And so you get reoccurrence of these clinical signs. The birds are also immunosuppressed. So with the immunosuppression, you can also develop secondary bacterial infections on top of the avian gastric yeast. And it would be worthwhile to try to treat those secondary bacterial infections to try to reduce any extra stress on the bird, and to allow the bird to digest the food and to be as healthy as it can be, while it has this really, at this point in history, incurable condition with the avian gastric yeast. So whether it's been definitively diagnosed or not, your veterinarian is hedging the bet unless it's been definitively diagnosed, and that's not a bad thing to do with this, because it's very difficult to definitively diagnose avian gastric yeast. And say, why can't we just do it? Well, you can take a fecal sample, you can take a crop swab. The avian gastric yeast, where it really likes to live is between the proventriculus or true stomach and the ventriculus or the gizzard. And it's called the isthmus. It's right between the two. That's where it really likes to populate, and you can't get down there in a budgie unless there's just no way to get down there to identify it. So you hope, and sometimes you can pick it up on crop swab and look for it under the microscope, or fecal or cloacal swab, that may be helpful. So that's why it's like, we haven't been able, and your veterinarian may have looked for that and and did those tests, but didn't see it. But at the same time, the negative tests and see, in that manner to identify avian gastric yeast aren't very sensitive. And you just, sometimes you're lucky and you do, like, whoop, there it is, that, I confirmed it. But this is one of those where the treatment is kind of going along with what it very possibly may have. And so the only thing is you can culture it. Possibly they have the next generation sequencing, which is called, it's a company out of California, My Dog. And if you get a crop swab, they may be able to use their technology to identify avian gastric yeast that way. I need to talk to them about that in particular, because it is very difficult any other way to identify it, and you're not going to be able to grow it on a conventional culture. So that's what you're looking at there. So hopefully that's some helpful information.
Yeah, and we have a question from Alex about what would you do with a 20-year-old conure with Candida SSP? They're giving him probiotics because he's been given strong medicine like nystatin. Thank you, nystatin, and some others for amoeba. How long is it okay to give it? And they've been giving it so far for 5 weeks. They need to have a blood test to know if the kidneys and liver are okay. To give fungal medicine. So we're again talking about fungal medicine. Is it dangerous to withdraw blood from a small bird like an orange-fronted conure? Does it need any anesthesia? So he doesn't show any symptoms, but their poops are not nice, very watery, and not much urea.
So what kind of conure is this?
We're talking about I think an orange front. Wait.
Green cheek conure?
Yeah, or orange-fronted conure.
Orange-fronted conure. Okay.
Mm-hmm.
So I guess there was one question in there about collecting blood. Okay. In collection of blood is that we usually say it's safe to collect 1 cc of blood from 100 grams body weight. So basically, if you have a 100-gram cockatiel, you could collect 1 cc of blood safely, and get and with that you can get a complete blood count, white blood cells, red blood cells, total protein, packed cell volume, look for inflammation, look to see if the bird's anemic, and see if the inflammation has been long-term or short-term. There's so much, and like I said, arguably the best diagnostic test that you can submit to kind of get a general assessment of what the bird is doing. And then the chemistry panel. So you can get a chemistry panel that gives you your electrolytes, your some enzyme levels on that, your blood glucose, and so that's a couple of tests that can be run to look at that. The one thing that you had mentioned, it was like the bird had candida species.
Candida
Yeah, it had a
SSP.
candida species. Candida albicans is usually the most common candida organism that is identified. And the one thing about candida, it's a yeast, and fungus yeast there, and what you'll normally see in most birds, they will have some candida organisms that are within the GI tract. So it's not unusual to see a healthy bird, quote unquote healthy bird, with some candida organisms in there. However, candidiasis can kill a human, it can kill a bird. But that's extremely rare, and that usually occurs with the underlying situation. If a bird has candidiasis, is why? Why is it clinically significant? Why is it causing clinical disease? Because that usually denotes why people die of it is if they're immunosuppressed, if they have chemotherapy, they don't have any white blood cells or what have you, the candida overwhelms the system and it'll kill them. In the same way with birds, that's the same underlying situation that you have with it becoming a clinical disease when it becomes problematic. Hyacinth macaws, they'll get candida lesions on the oral side of their young hyacinths. I'll get them there. Birds will have candida lesions in the mouth. Young, and I mentioned young hyacinth macaws being hand fed. Well, of course, they're going to be immunocompromised. Their immune system they're going to be growing. There's going to be a lot of stress on the bird that's going to affect the immune system adversely. And so that's the other thing about an older bird that would have any type of candida, within that. You can get candidiasis when you have sour crop, is with the smell that comes with the kind of fermentation and the bacterial growth that occurs in the crop with the food that isn't digested or is not being digested properly. And so candida can be a part of that whole process, and that can occur due to secondary and kind of overgrowth of candida organisms due to primary bacterial infection, and also immunosuppression or immunocompromise due to a young bird. So when you have candida as a clinical disease condition that needs to be treated, I'm going to show you a bird that's immunocompromised, and so that bird needs to be addressed on top of everything else. But you need to treat the candida, and then when you treat the candida, you say, well, you treat it with the nystatin. Nystatin only works when it's a relatively safe drug. There's not many side effects, but nystatin only is effective when it comes into contact with the organism. It's not like you give it and it goes through the body system and then it develops therapeutic levels and then the blood and that's it'll kill the organism systemically. No, you have to actually pour the nystatin on the organism. Okay, and so if you have plaques, oral candida plaques, then you have to use say a swab and kind of swab that candida and make sure that is painted on the lesion. They make mouthwash for humans, so you can swish it around in your mouth if you have thrush or trench mouth is a common term for candida infections in human oral cavities. So that's the candida problem. kind of overview. But you know, also it needs to be, you know, kind of addressed to see, you know, again, why the bird has candida, and it's if there's some type of an underlying, is it secondary to a bacterial infection? Is there some other inflammation? You can give candida for that long, but there should be some resolution in that situation. Anytime, it's just like with the regurgitating cockatiel, you never can discard if you have a prolonged problem like this. If you've treated a number of bacterial infections, you've treated the candida, and it's still occurring, there could be gastric cancer. So you could have a neoplasm, you can have a neoplasm, you can have a gastric tumor in there. And the thing is, with gastric tumors in birds, they're not going to be a big. So you think of a tumor, you say, well, gosh, it's going to be a big softball in the middle of the stomach. No, that's not how it works with bird gastric tumors. They kind of go in the wall of the stomach, so it's hard to you know, you can't take a many times you can take an X-ray and say, well, let's look and see if there's a mass in the stomach, because the tumors are in the wall of the stomach, not growing into the stomach. And so with the tumor in the wall, there's a kind of you know, it affects the function, and so you can have and the ability of the GI tract to protect the bird from bacterial infections, and lead to some of the regurgitation, lead to you know, recurring bacterial infections and candida infections. But 5 weeks of candidiasis is you know, or 5 weeks of nystatin treatment isn't too much, but you know, it should have been resolved, whatever the problem was before. You know, usually 14 days is plenty of time for most candida infections with nystatin. The one thing, like I said, it's where you have to touch the organism with the nystatin, but there's also diflucan. Fluconazole is a antifungal medication that is effective in treating candida, and sometimes they'll make but that's more of a systemic treatment. And so sometimes we've made kind of compounded nystatin and diflucan together. So give it at the same time, and then you get both the topical effect, and then you get the systemic effect and more severe candida infections. But always with a candida infection, looking for what's the primary, you know, underlying cause for having this really commensal organism that is within the normal GI tract, why it's causing and creating the disease condition. Yeah.
Okay.
Very good question. Yeah.
Yes. Okay, let's see if we have okay, so we have a question from Sandy about a 3-year-old male parakeet that's regurgitated his head in an up and down kind of circular motion. So he's fluffy and sitting against his K&H heater, and very subdued. This has happened numerous times over the last 2 years. So he's good.
I think Laura has problems with her computer, and that's a good assumption right now. And so what I would suggest is that
Sorry, I lost my connection.
no,
Did you get it?
no, that's okay. So you had the little budgie, and it was not doing well with the it was regurgitating
So yeah, it's a 3-year-old male budgie regurgitating his head in like a kind of an up and down circular motion, and then Fluffy and sits against his heater, and it goes on for like 6 to 8 weeks, and then it happens. He's good for like 6 to 8 weeks, like a stretch of time, and then it happens again. And then after a few days of bay trail, he starts, acting normal and chirping happily.
Mhm.
So
Well, the one thing that you look at, and this is a kind of a good question. We always get good questions.
you
I don't know,
do.
but nonetheless, so the little bird does this, and then after a few days of Baytril, it said, I don't know how long uh, the condition is, as far as how long the treatment's for. But so it does seem to have a treatment response, but it keeps coming back. Okay, it keeps
Mhm.
reoccurring. Um, this is where, in all indications, if you're giving an antibiotic medication, uh, I will have to, uh, yeah, that if you give an antibiotic medication, that it would be a bacterial infection that would be causing this. Okay, since you're getting a treatment response, that's the best assumption there. Now, then why is it reoccurring? Well, one is the bacteria. Is it sensitive to the antibiotic? It could be partly sensitive because you're getting a treatment response, or not very sensitive, but between the antibiotic and what it can do and the immune system, it's enough to kind of get the bird feeling better. And so that's one of the things, is that if you have a recurring, if you have an initial treatment and you don't, and it doesn't work, then that needs to be identified. The bacteria needs to be identified so you can put it on the proper medication, and make sure that the medication that it's put on, that it would be administered properly and for the appropriate time. um, and keeping that in mind, if it's the bird isn't treated for the appropriate time with the appropriate amount of medication, it will not get better. And so that's when you get into how long the bird, you know, is, on the medication, is also needs to be considered, because with bacterial infections, I'm one to make sure that I don't give that bacteria any chance of of being able to get away from this treatment and to hide. I want to make sure that whatever occurs, that it's treated appropriately for the appropriate number of days. And there's a lot of different variables that go into how long the antibiotic treatment is. How long you should treat the animal for with antibiotics. There's a lot of variables in there, and you have to consider those when you are when as a doctor you're prescribing that. And so that has to go out. And if it's just, yeah, and usually it's not just till the animal looks better, you
Mhm.
know, because that's just the beginning. You want to make sure that you kill all of those pathogenic bacteria as possible, so that it is totally resolved. But as with this budgie case, you always have to think about avian gastric yeast as a confounding factor with these GI issues with budgies. It may not be, but it always has to be a consideration on that. But it appears that the bacterial infection is, it's a bacterial infection due to the medication response, the treatment response, but at the same time, it needs to be identified and make sure that the medication that is effective in treating that particular organism, and then treat it for an appropriate length of time to make sure that that bird has the best chance of total recovery.
Okay.
There
All
you
right. There you go. And that's our time. Quick.
Well, and time flies when you're having fun.
That's
And
right.
and have great questions. And I'm just just grateful for all of these great bird owners that have these questions and are doing such a great job. And always look forward to and we touched on a number of different subjects that we haven't in the past. And
Yes, for sure.
always,
Yes, absolutely. And I mean, that was so, yeah, people, so it's great to have this back, to have the Ask the Vet back as our kickoff one for the year ahead. So a lot of, I'm sure, interesting and important questions on our next episode. And
yeah, I mean, looking forward to a great 2025. I'm
yay!
telling you, yes, very much so.
So on
Yeah.
that note, I gotta announce next Friday's webinar. We are going to be on with Dr. Jorg Mayer, and this is going to be an interesting topic. It's apitherapy. So I didn't know what that was until I saw what it's about, and this is super exciting. He's going to talk about apitherapy, which is the use of products derived from bees, like honeybees, as medicine, including venom, honey, and pollen. And so this will be a really fascinating look on how like honey and bees and stuff can be good for our birds. So got to tune into that. That'll be next Friday, same time as today.
Yeah, and Dr. Mayer is Meyer, Jorg Meyer from
Oh, did I say it? Okay, yeah, I
uh,
probably said the
Jorg
name wrong.
Meyer. Yeah,
Meyer.
he is he knows his bees. Let's put it that way. Yeah, he does know his bees.
There we go. Yeah, this will be a buzzy webinar. A lot of buzz, I'm sure, afterwards. So please join us next Friday for that one. Dr. Tully, we'll see you back in March. Yeah, March into March. Okay, we're marching straight toward March. Thank you again for joining us. I want to wish everyone a wonderful weekend. Everyone stay safe. All the best to you and your flock. Until
All
next
right.
time.
Thank you so much. Thank you, Laura. See everybody in March. Thank you,
Bye.
all attendees. Bye-bye.